Good morning, Jewish Senior Life team. It's Wednesday, April 8th. This is Mike King. I'm with Michelle Sharano and Marie Adelat for another one of our weekly updates. Well, it's been 27 days since we actually restricted visitation and locked down our campus here, and a lot has happened across our organization. I will say since our last update a week ago, as you'll hear from Marie and Michelle, we have some really good news. Our only positive COVID patient has recovered. He's had 2 negative tests, so we've really are COVID-free as of this day in our building. Probably will not last. We'll probably have more COVID come in into our campus, but this is really a reflection on all of you, the great work that you have done to help protect our residents in our campus. I've been appointed to a county task force, a Monroe County task force, and what I'm learning is that we are doing all the right things. Many homes are really struggling trying to figure this out, but you should feel very comfortable and assured that the leadership is on top of this. What you are doing is important. Things like PPE, fortunately, we got out ahead of that, and we've got orders still coming in and orders still going out so that we can ensure that all the battle gear that you guys need is here and on site. Last week, I mentioned that there's going to be a recognition coming for those that stuck with us, over the past 4 weeks, and that are going to hang with us over the next 4 to 6 weeks when we have our surge coming. The details will be shared hopefully in the next couple of weeks, but I will tell you, depending on your status in the organization, you could receive up to $1,000 when we do announce that officially. Also, I want to remind everybody that it is Passover and Easter. It's a time for remembrance for all of us, but don't forget we have a rabbi here on our staff that can be very supportive to you as you may be struggling spiritually or with any of the challenge that may be going on. Our rabbi has been deployed across our campus and has done a great job with some of our staff and departments in terms of calming down fears, reassuring them. So don't hesitate to reach out to Rabbi Stephen at any point in time. The other good news is we received our SteriMist disinfectant machine just this past couple of days. So Rob Lewis has now started to deploy that across our campus. And as a reminder, this is a very unique machine that actually sends out hydrogen peroxide into areas that we want to help defeat the COVID-19 virus. So we've already started using it on our second floor. We'll be using it with Chris Alberti over at the Summit as well. So everywhere on a campus, disinfecting and infection control procedures are high priority for us. So again, just a reminder, as I said last week, this virtual foxhole that I talked about, this 6-foot radius, the social distancing, is really important. It's important while you're here at work, it's important while you're at home, and it's important if you're out in the community. Please continue doing that, and I'm confident we will continue to help keep the enemy at the gate. Thank you.
Hello, everyone. Another update. As everyone knows, the COVID-19 cases in our community are increasing, and we're in an acceleration phase still. We expect the peak in 3 to 4 weeks in our area. I think everyone is aware that at the Jewish Home, we are aggressively testing any patients or residents that have fever and respiratory symptoms, and so far we have had only 1 positive. That person has now recovered. We have no cases of COVID-19 in-house that we're aware of. However, we expect that to change over the next weeks and months. The major focus that we've been working on recently has been employee care and best practices for keeping employees safe and healthy. And just to put in a word, you're all aware, but it is very, very important to keep self-isolating at home when you're not at work, and to wear the mask at work at all times unless you're alone in a room, and to keep 6 feet or more away from others while at work to prevent any transmission back and forth at work. Also, the personal protective equipment, it's very important that you wear that correctly, and remember there are videos about how to wear masks, how to wear full personal protective equipment, and there's a new one out about how to reuse personal protective equipment. So don't underestimate how important all that stuff is. It seems not as important, but it is the most important. We're working on a new project here. I think everyone will really like this. We are offering employee COVID testing, and we do offer this for employees that have symptoms. So you need to have some symptoms such as a fever. We're looking for 99.5 or above, and other symptoms such as cough or shortness of breath or sore throat or muscle aches. The test is not because you're worried that you're feeling okay, you're a little anxious. That's not what the test is for. The test is if you're feeling sick. We will be doing the swabs ourselves and sending them to the Strong lab. We've had excellent turnaround with results in 1 day to 2 days. We really want to roll this out because it is a best practice for our employees. So we're going to put the number to call on the website. We would like you to schedule an appointment. And right now we're just putting this program together, but we're thinking Monday through Friday between 10 and 2, we'll have an appointment time for you. And then you can pull up to the front entrance in your car. We will come out, do your test through the window. It takes less than a minute. It's free. It's going to be paid for by the Jewish Home. And we will call you within 1 or 2 days with your results. Again, the reason we're doing it is because it's a best practice, because a lot of people are having trouble getting the test results back. They're having trouble getting their tests done. You are our greatest resource, and we want to give you the absolute best access to testing. If you are ill with COVID or otherwise, the recommendation is to stay home to recover. If you need to see a medical provider, call your doctor. If you don't have a doctor or you can't get in with your doctor, we are recommending the Strong Urgent Care System because they send their tests to the Strong lab with a high priority and the results come back quickly. So we will have the phone numbers of the 4 Strong Urgent Cares on our website, and they are in Pittsford, Henrietta, Penfield, and Greece. Again, if you do go to the urgent care and they do a COVID test there, Jewish Home will pay for the cost of that test. The cost of the visit where they do the assessment, you and your insurance will be responsible for. If you do get a bill for your visit, bring it to Employee Health and we will reimburse you the cost of the test. We're also working on doing close follow-up of any employees that are out, and we're putting together a team, including myself, Greg Lott, Aaron Reese from HR, and Heather Cook-Smith, one of the nurse practitioners, so that we can track all the tests closely, track you and your symptoms, give support, check on you at home, let you know when it's safe to come back to work. And just to close, just to remember that as Jewish Senior Life employees, you are of the greatest importance, and your health and well-being is what we're looking out for. We're putting all of the testing and follow-up in place to make sure you have the best possible access to testing and the best possible care. Thank you.
Good morning, everybody. I'm here for another update. I hope all is well with you and your families. This will probably be a little bit repetitive from last week. Not a lot has changed as far as at the Jewish Home, which is good news. So just as a reminder of employee benefits, we still have the food pantry weekly, employee meals, and our success coach is available still. Free employee massages, we actually have had 15 done, and haircuts, 9 done, 3 scheduled, including myself. Thank you, Jana. And we did have the one-time farmers market, which was a huge success, and the employees really, really appreciated that. So I'll just go right into, here's our schedule for continued this week on Tuesday, Wednesday, and Thursday. Reminder to make appointments for your massages and haircuts. We still have a new admission protocol. Our 2 South wing is full for 10 days. Each person is on contact and droplet precautions, and all staff must wear PPE. And then if cleared after 10 days, they move off of 2 South, and then we'll take more admissions from the hospital as needed. And then the COVID-19 wing I talked about last week, and that is completely empty at this time. And we are looking to do another actually admission wing, which is would be on 2 North. So we'll keep you updated with that. The COVID-19 protocol for long-term care, the tower and cottages, that remains the same, has not changed. We do not have anybody on this protocol at this time, which is a good thing. And the COVID-19 results, they come back within like 24 hours when we do a test for anybody. In the PPE update, we still have a lot of gowns, a lot of masks, face shields, a lot of supplies. Just as a reminder, please make sure that you wear your face mask if you're at least 6 feet from each other, employees or residents. It's really, really important to make sure that we have our face masks on at all times. And I know it's difficult for people to breathe through them. So if you go outside of a common area or a resident room, that's the time where you can take it down and breathe a little bit. Reminder to watch the videos, the PPE videos and communications on JSL Internet, as well as there's videos for families that we did the other day, actually. We did a family conference call that you can listen to, and that'll be posted also. And the good news that we shared with the families was the window visits, and those will start April 13th, scheduling with Megan Bevins and her team, and the families are really, really excited about that. And also Adrian, our social work department, has set up a email, resident@jewishseniorlife.org, where families can send pictures, notes, and then we'll distribute them to their loved ones. So that we did have some good news for the families yesterday. And pretty much that's it for my update. And I hope everybody stays healthy and continues to come to work. And thank you.
Well, in closing, you heard another round of good information from both Michelle and Marie. I want to remind everybody we're all in this together. As I talked about last week, all of our indirect staff, starting with the senior management team and our leadership group, are going to be entering into some mandatory training. We're calling it Help on Demand. But what that means is, as we start experiencing challenges in different areas of the campus, it could be over at the Wolk Manor, it could be over in one of the cottages, we will now have individuals like myself and others that are going to be trained to help support each one of you as we make sure that our residents receive the care that they need to stay safe and well. I also wanted to take a minute and share with everybody some wonderful notes that I've received from some families, from some residents. I don't have time to read them all to you because the people taping this session said I had to keep it short. So I'm only going to do 2 or 3 of them. So this first one is from a friend of mine, someone that many of you may know, the previous CEO here, Arnie Gisson. He actually wrote an editorial in the Sunday paper. And if you haven't seen it, I do want to read it to you. So it says, doctors, nurses, techs aren't the only ones who deserve praise. Certainly they deserve a lot of praise. As a former health department employee and retired 20-year nursing home administrator, I also want us to recognize the contribution of so many others that provide the backup, allowing this skilled care to continue. Nursing assistants who clean, feed, and turn patients, housekeepers doing their jobs to reduce contamination, food service workers preparing and delivering complex meals under very restricted conditions, transporters seeking the safest routes possible, engineering staff ensuring the power needed and equipment in good working order, purchasing people searching for scarce medical supplies, financial and clerical staff performing tasks far out of their job descriptions, management staff orchestrating all people directed at one goal, safe and effective care. I thought that was a great message from Arnie. Here is a letter that I received from a family member over at the summit. It's pretty lengthy, so I won't read it in detail, but here's the essence of it. Please give our thanks to all the staff at the summit. We are so glad we are living here during this coronavirus crisis. This is independent living, but as seniors, we would be in trouble if we weren't here. We are not supposed to go outside since we are the most vulnerable of this disease. The staff is so helpful and caring. We are lucky to have 2 sets of children to also help us. Others here have no one. Everything has been set up well, and if necessary, updated things change because of the crisis. The usual living routines at our previous home wouldn't have worked. We would have needed extra help. Here we have it. As I've said often, come here so you can enjoy everything here, including all the programs, before something bad happens with your health as you age. Here is another letter from a Jewish home family member, and it just says, just a quick note to extend our sincere appreciation to all of you and your staff members to keep my mother not only safe and comfortable, but also engaged as much as possible. This past week, the receptionist, Molly, conducted a FaceTime call for me while tending to my mother, which is incredible. Senior staff certainly has their many other tasks to tend to as well. My sister, who has had many interactions with other staff members at the Jewish Senior Living Facility over the past 6 weeks, has commented many times how accommodating and how professional all of the staff members have been. Thank you very much. And lastly, I wanted to share with you a wonderful note we received from a CNA who has retired. She retired, I believe, last year. It's Roxanne Siracusa. I've known her well. I've been here 15 years. I think she was with me the entire time I was here. But let me read this great note that she shared. Thoughts, prayers, and virtual hugs to all healthcare workers and staff at Jewish Senior Life. Your bravery and courage shows us what heroes are made of. Stay strong and safe, and know that your community supports you. And in closing, let me just say again, thank you for everything each one of you are doing for our residents, for our families, for each other, lifting each other up and supporting one another. We will get through this. We will come out on the other side, but it's important that we all stay strong. Don't be afraid, but be diligent. Thank you.